It's interesting, really, isn't it? We've just taken a few steps around this city, but it makes you wonder about the 9 steps for buyers, really. And I think one of the first one is location. Where do you want your practice to be? Choose it and think about it and go and visit it when it's not necessarily quiet. Go at normal busy times, because the danger is, isn't it? You choose the wrong location.
Yeah.
And once you're there, you're sort of there.
Yeah. The second step for buyers that I don't think people always grasp is the daily grind. You pick your location, but you're going to be going to this practice 4, 5, 6 times a week. Make sure you're comfortable with that journey on a daily basis.
Definitely. Another one is looking at your budget.
Yeah.
Making sure you've got the right budget, because when you buy a house, you don't sort of go and look at every house, do you? You sort out how much you can borrow, and then that's your budget. Same in the dental practice. Select your budget and stick to it.
Size matters. Quite often people laugh at this, but it does relate back to budget, because once you've set your budget, that's going to kind of set the sort of size of practice you're looking for, whether it's 2, 3, 4 surgeries. But also with that comes a management responsibility. So really think about the sort of size of practice. 1, you can afford, but 2, you're going to be comfortable managing.
Definitely. Another one is about making sure that you choose a practice that fits with you. Is it something that you can do? If you're not an orthodontist, don't buy an orthodontic practice. If you're an NHS practitioner and you've never worked in private, don't buy 100% high-end private practice. It doesn't mean that you can't get to that, and it's good to have ambition, but you should be realistic when you're making these decisions.
Yeah. There's a phrase, learn from your mistakes. I think it's a rubbish phrase. I think it's much better to learn from other people's mistakes.
Definitely.
And that's all around seeking out specialist advice. There's people that have been down this road before you. Solicitors, accountants, valuers, brokers, finance providers. Use their experience. Use that specialist advice.
Definitely. So true. Another one is that there's practice view and there's extra fun. Sort of on a really, really simple level. I think one is like turn up on time, turn up on the right day. And when you're there, try to create a rapport, with the seller. It's not that hard. Some people do.
I think an area where some people don't quite get it right as a buyer as well is sometimes you need to take action. If you see a practice you like and you want to move forward with it, you need to make your intentions known, take action, put in an offer.
Yeah.
Is that it? Is that the full set?
Following on from that is, once you've sort of started, just keep going. It's momentum, isn't it? You don't start stone rolling and then it stop halfway down the hill. Once you've started the process, keep it going, because you have to keep it going, otherwise it will fail.
Absolutely. Well, there we go. I think that's the 9 tips for buying a dental practice.
Definitely. Say that again.